A state-of-the-art facility, staffed by a team of highly skilled surgeons, anesthesiologists, physician assistants, and nurses, committed to you, your care, and your recovery. The Morgan Heart Hospital at Morton Plant. From diagnosis to open heart surgery, you've traveled a well-worn road of illness, anxiety, and discomfort. It's time you started feeling better, to journey a new road, one that promises restored good health and peace of mind. In this presentation, we'll discuss your discharge instructions as well as specific guidelines which will help ensure a safe and successful recovery as you continue down the road to wellness. The first thing most patients want to know is how long it's going to take until they're feeling better. While recovery at times can seem like slow going, most patients feel much better within 4 to 6 weeks. In fact, many patients make a full recovery within 3 to 6 months. You're encouraged to look for weekly progress rather than daily improvement. Your body will tell how much activity you can handle, but by following a few simple rules, you'll experience more good days than bad during your recovery. If you're going straight home from the hospital, your home health care visits will typically begin the day following your discharge. The home health care team will contact you to schedule the first visit. If you're going to a rehab center before heading home, then the rehab center will arrange your home health care visits. Because we want to help ensure a successful recovery, you'll also receive follow-up phone calls from the cardiac surgery team here at the hospital. We'll check on your progress, answer questions, and provide advice and reassurance. While we hope you'll consider us a helpful resource in your recovery, remember that you can call your cardiac surgeon at any time should you need help or guidance. You've just had major surgery, and it's going to take some time before you're feeling like your old self again. You may feel weak, tired, and experience decreased energy. You may also experience a wide range of emotions. It's very normal to feel sad or down at times. You may also experience aches, pains, stiffness, numbness, or tingling in your incision areas. You may have mild shortness of breath, especially with increased activity. You may not have much of an appetite, and you'll likely have trouble sleeping at night. Again, these feelings are normal and may last for a number of weeks. While we encourage you to set your own daily routine, we do ask that you complete a few very important tasks every morning. These tasks will help us monitor your progress. Take your temperature and weigh yourself each morning and record your temperature and weight on the daily record which we'll provide you. Be sure to answer the infection and fluid retention questions found on the left side of the weight record. Call your surgeon if you answer yes to any of these questions. Again, these simple tasks should be completed first thing every morning, even before your first cup of coffee. Most patients find it difficult to sleep through the night for the first few weeks. Propping yourself up with a number of pillows may make you more comfortable. So may a wedge under your mattress to help elevate your torso. You may be more comfortable sleeping in a recliner or on the couch propped up by pillows. You may find it easier to sleep by taking your pain medication just before bedtime. While you're certainly encouraged to rest during the day, we do not advise that you take many naps. Too many naps will make it more difficult to fall asleep at night. Contact your doctors if you have a lot of difficulty sleeping. They may recommend an over-the-counter sleeping aid or may even call in a prescription to help you rest. Having pain is normal after surgery and could linger for a number of weeks as your body heals. Your pain should become less intense as each week goes by. Don't be alarmed if you feel pain in your incision areas, chest, throughout your shoulders, possibly even in your upper back between your shoulder blades. Manage your pain by using the pain medication prescribed by your surgeon. Managing your pain will allow you to be more productive during the day and sleep more comfortably at night. If you find that your prescribed pain medication is too strong, you can use Tylenol products for minor pain, but do not take any additional aspirin, especially if you're on Coumadin. Also, do not use any ibuprofen products such as Advil or Motrin without consulting your surgeon first. Also, staying active and completing your exercises as you were instructed in the hospital can help reduce stiffness and soreness. While some fluid retention is common following heart surgery, we ask that you be mindful of a few important symptoms and report them to your surgeon. These symptoms include an increase in your body weight of 3 or more pounds over a 2-day period, or an increase of 5 pounds over 1 week. Increased swelling in your feet and ankles, or bloating in your abdomen. Increased shortness of breath while at rest or lying flat in bed. There are a few simple steps you can take to help prevent fluid retention. First, take your diuretic or water pill as you've been prescribed. Though you may find some of the medicine's effects to be aggravating, do not stop taking your water pill without first checking with your doctor. Also, be sure to keep your legs elevated as much as possible, especially while sitting. Finally, avoid adding extra salt to your diet. Salt causes your body to hold on to water. It's okay to cook with a small amount, but do not add extra salt to your food once it arrives at the table. You should also limit your consumption of foods that are high in salt, such as lunch meat and cheeses, TV dinners, processed foods, snack foods such as potato chips and canned soups and vegetables. Sodas and sports drinks also contain excess salt and should be limited. It's important to keep your incisions free of infection. You can help prevent infection by cleaning your incisions every day with water and an antibacterial soap such as Dial liquid hand soap. Your incisions should not be submerged, so we recommend that you clean the sites in the shower, though a sponge bath would be okay. Clean each of your incisions with a separate clean washcloth. To illustrate, let's assume that you have an incision on your chest and one on your leg. First, gather 3 clean washcloths, one to wash your body and one to wash each incision. It's okay to use any color or material of washcloths, just make sure not to reuse washcloths from the day before unless they've been freshly laundered. When you shower, use a shower chair if you find it helpful and avoid using water that's too hot. Now, begin by rinsing your entire body and then washing and rinsing your hair. It's important not to let the direct force of the water to hit any of your incisions. Lather your first washcloth with antibacterial soap and wash your entire body except for your chest and leg incisions. Rinse and set the first washcloth aside. Next, lather the second washcloth with antibacterial soap and gently wash directly over your chest incision using light pressure. Rinse and discard the second washcloth. Repeat the same steps for your leg incision using the third clean washcloth. When finished, dry yourself with a clean, dry towel. Pat dry your incisions first and then dry the rest of your body. Do not wash your incisions with hydrogen peroxide, alcohol, or betadine unless instructed by your surgeon. Finally, do not apply any ointments, creams, lotions, or powders to your incisions for 4 to 6 weeks, and this includes vitamin E, aloe, and neosporin. Do not submerge your incisions in a tub, pool, or jacuzzi for 4 to 6 weeks, and avoid direct sun exposure to your incisions for 2 months. Also, women should wear a bra to prevent strain on the chest incision and breastbone. Examine your incisions every day and report signs of infection to your surgeon. Signs of infection include a temperature greater than 100.5 degrees Fahrenheit, increased redness, heat, swelling, or pain around your incisions, green or creamy yellow drainage or drainage that is odd smelling, a change in the amount or type of drainage. Small amounts of clear, pale yellow, or blood-tinged drainage is considered normal. Drainage is particularly common from the chest tube sides. Good nutrition is very important to your recovery. By eating a well-balanced diet, one that includes fresh fruits and vegetables, you'll promote healing and gain strength. You'll also want to lower the amount of fat and cholesterol in your diet. This means limiting your intake of red meat, cheese, and eggs. It's also important to drink plenty of liquids, which helps prevent dehydration, low blood pressure, and constipation. You're encouraged to drink 6 to 8 8-ounce glasses of fluid a day. Approved fluids include water, milk, juices, and anything frozen that melts at room temperature, such as Jell-O or popsicles. Coffee and tea are also acceptable, but be careful to limit your intake of caffeine. Caffeine is a stimulant and can cause your heart to beat too fast or become irregular. Finally, consumption of alcohol, including wine and beer, can decrease heart muscle function and should be avoided. Avoiding alcohol is especially important if you're taking pain medication or Coumadin. If you are a diabetic patient, please be sure to follow your diabetic diet. It's important that you continue to check your blood sugar level at least twice a day, once before breakfast and once before dinner. If you find that your readings are consistently over 150, contact your doctor. They may be able to adjust your medication to help you better control your blood sugar. Diabetic patients run a greater risk of infection, especially if blood sugar levels are consistently greater than 150. Some patients who are not diabetic develop high blood sugar levels as a result of their operation. Your blood sugar will be managed similarly should this happen to you. If you'd like to learn more about controlling your blood sugar, ask your nurse for a copy of our book, Stepping Towards Control Before Going Home.